Do you or some of your patients, if you're a doctor or a medical student, have pain that is radiating into the first toe, or maybe the second and the third as well? Is this pain somewhat electric? Does it give the patient somewhat of an electric sensation or burning sensation? With such symptoms, we have to think about the condition called the tarsal tunnel syndrome. In my previous video, I talked about the carpal tunnel syndrome. So now we talk about the tarsal tunnel syndrome. But where is this tarsal tunnel? The tarsal tunnel is on the inner side of the ankle joint. But why does this syndrome happen? Well, it is usually because of the compression of the tibialis nerve in that tarsal tunnel. So that is the structure of our interest here, the tibialis nerve. So what is actually causing this compression that can irritate or even damage the tibialis nerve? Sometimes we don't know. We simply don't know. But sometimes we do know. And when we do know, it can be a whole variety of things. It can be tumors, cysts, inflammation. There are also factors that can contribute, if not cause, the condition. Professional athletes, for example, people who put strain on their ankle joint more, are more likely to develop this condition. Also, obese people that are quite heavy and thus also put more strain on the ankle joint are more likely to develop this condition. People who have flat feet, for example, are also another group that is more likely to have it. So there is one thing that can cause so many issues and symptoms all over our body. It can cause so many symptoms it's hard to count them. And it's not smoking. So smokers can be calm about the tarsal tunnel syndrome. Smoking also contributes to a whole lot of stuff, but as far as I know, and as far as I read the relevant studies, it's not a risk factor for tarsal tunnel syndrome. However, there is one thing that causes a whole lot of other symptoms, but it can also cause the tarsal tunnel syndrome. And that is very simple, an injury. Injury can happen anywhere, and it can happen in the tarsal tunnel as well. If the patient can recall of some injury that might have happened there, then there are a lot of explanation how this injury can cause the irritation of the nerve. Now that we have discussed one such simple cause, there is also one cause, and that is the varicose veins. Now that's a little bit uncommon, but yes, it can also cause the compression of the nerve. So let's say we have talked with the patient, we heard what the patient has to say, and now we have to diagnose the patient because we heard everything. Now we need some sort of proof that it really is the tarsal tunnel syndrome, especially before we continue to therapy it in a surgical way. So the first thing that can be done, and it's a very convenient examination, is to perform a test searching for the Tinel sign. The Tinel sign is basically when you tap on that region, and you expect to provoke similar, if not the same, symptoms that the patient has. If Tinel sign is positive, it is indicative of the tarsal tunnel syndrome. We could also perform an MRI scan or an X-ray scan. But in an X-ray scan, we don't really expect to see much. Actually, if we really want to diagnose the tarsal tunnel syndrome, we shouldn't see anything wrong in the X-ray scan. Normally we're trying to exclude stuff such as fractures of the surrounding bones. In an ultrasound, we could exclude an inflammation of the joint capsule. And nerve conductivity tests could be used together with the Tinel sign to properly diagnose the tarsal tunnel syndrome. We have discussed symptoms, diagnosis, and now we should talk about the treatment. There are some ways to prevent this. For example, an obese person could lose some weight, but it's really hard to predict when this is going to happen. So what are the treatment options here? What could be done? Well, there are two ways to go about this. The conservative way and the surgical way. So what could we actually do before we proceed to the surgery room? Well, we have to think about the causes of the condition. Remember, we said putting strain on the ankle joint. Obese people and professional athletes are more likely to develop this condition. So, movements such as eversion, plantar flexion, inversion can actually increase the compression of the nerve. So, immobilizing joint with a brace is one option. Second option is also losing weight. Sometimes finding a proper fitting shoe. It's a rather simple but an important thing. Finding a proper fitting shoe can solve the symptoms sometimes because the bad shoe can cause the compression itself. Furthermore, we can try to apply physiotherapy and also cortisone injections. These injections are anti-inflammatory and they reduce the swelling, and this can also reduce the compression of the nerve and relieve the patient of some symptoms. The surgery that we're interested here is called the tarsal tunnel release surgery. In this surgery, we want to release this Nervus tibialis, that's the Latin expression. So in English, it's tibial nerve. We want to release that tibial nerve from the tarsal tunnel. Above that nerve is basically connective tissue that is called flexor retinaculum, and that is creating this tarsal tunnel. So we want to cut through that tissue. Before we do that, we also want to separate the tibial nerve from the tibial artery and the tibial vein. We also don't want to make the incision go too inferiorly all the way and then reach the plantar side of the foot. We don't want to go that far with incision. Some of the studies actually had horrible results for this surgery. If not horrible, then definitely not great. Less than 50% of the patients reported an improvement of the condition, and rate of complications was around 13%. Now that's pretty high, considering that the surgery is far away from all the vital organs and it's not really deep surgery. So you really want to consider all possible conservative treatments before surgery is actually then considered. Speaking of symptoms, if you need more help and information with symptoms, then go to our website, Symptomsky.com. There we have good experts and also our so far best artificial intelligence software for symptoms. And if you're a medical student or a doctor, then don't go to Symptomsky.com, go to Anatomsky.com, and there we have software for educating medical students and doctors. And both of you can actually subscribe to this channel for future videos like these.